Welcome to Why Where Matters. My name is Paul E Zieske, and this is a place where we tackle the complex world of location-based services using a concept called enterprise traffic control. In this, the second episode, we're going to give a high-level overview of enterprise traffic control. And this is what I'm calling the dip your toe in version of the concept. So let's get into it. It's always good to start out with a definition, which is using situational awareness and automation to optimize mobile workflows across the enterprise. Both situational awareness and automation involve using location information. I like to use little slogans as memory tools, so this one is mobile first and workflows last and last. That means the location information we're using for situational awareness and automation is about the people and or property that are involved in the workflows. So let's start with the workflows. This is not just about providing a tool that presents real-time information to the users. A lot of what's being done in the market, in the location services market right now, is just that. Granted, those tools do provide some situational awareness, but we want to go far deeper and take advantage of the automation opportunities that are available to us. For us to get both situational awareness and automation, we need to instrument the workflows. To do that, we need sensors and sensing. We want to do that with a low barrier of entry, but a high fidelity to the information. We don't want to do a lengthy and expensive implementation of hardware, which we don't have to do because we're going to use the mobile devices. These are often called smartphones, but we need to be careful to remember these are powerful mobile computers, and that's how we're going to use them here. The phone is just a feature on that mobile computer. Next, we need an indoor GPS system or indoor positioning system. Those mobile devices need to know exactly where they are in the building, and they need to tell us where they are when we need them to. This can be done several different ways, but Apple has a product that costs us nothing more than the effort it takes to do the implementation. The product's called Apple Indoors. I'll provide a link in the comments if you want to learn more about that. We create the maps and do what's called an indoor survey, and now every Apple mobile device in the building is getting its latitude, longitude, and floor to about a meter or two accurate, and sometimes even better than a meter. It doesn't matter who owns the devices, the building is enabled and everyone gets it. Even 911 services. A reminder that this is not the only way to get indoor positioning. If we want to do this with more than just Apple devices, we can do that. So now let's look at the workflows, and these are hospital workflows, so this is in the care traffic control realm that we're talking about. Some of these workflows might already be using the mobile devices, so it might make sense to start there. And I'm going to use the Euro term mobile for what we're calling the smartphones because I want to emphasize these are mobile computers. And this is a good time also to mention that the mobiles and indoor GPS are getting us into this world of GIS or geographic information services. With Apple and Google Maps, Waze, even Uber and Lyft, you're using this technology. It's very powerful and opens up what's called geospatial science to us. Some of these workflows are couriers and some are people who are providing services around the hospital, and many are caregivers. For the couriers who are providing the transport of people and property around the hospital, let's look at what's moving and what's being moved. Mostly these are orders from the electronic medical record and some are support. Patients are being transported for tests, surgeries, and transferred to different units and for discharges. Lab samples are being moved, special order medications are being sent to the units. Medications are being stocked in the units. Then there's supply chain with the storage and utility closets that are being stocked. Then there's medical gases that are being moved. You have blood that's being moved. Food is being taken to the patient and the trays are being removed later. Then you have linens and even garbage and especially hazardous waste that needs to be considered. There's sterile processing of instruments, and these need to be moved around. Mobile devices like IV pumps are moved to be cleaned and then supplied around the hospital later. And this list isn't complete. For the services, you have the people who are responding to tickets and scheduled project work. We'll call these jobs. Medical equipment that's being repaired and serviced. There's facilities work that's being done, also called plant operations. There's security, and IT has to ensure that all the computers in the network is working correctly. Some of the tests that are being done for the patients are being done in their rooms, so services come to them. Respiratory therapy, which had a big role during the pandemic, and they need to go to the patient rooms when they're needed. Housekeeping is cleaning rooms, which is also called EVS or environmental services. They are the front lines for infection control. You even have things like pest control and a steady stream of vendors that are servicing equipment and other things that are in the hospital. And this is another list that's not entirely complete on the services side. Now, for the caregivers on the clinical side, there's less structure to the motion, but nursing is estimated to traverse 5 to 6 miles in the hospital each day. When you get into specialties like surgery, things are much more structured and there's a flow. They use checklists and there are teams that clean and prep the OR suites to keep things flowing. Radiology has patients and people moving around trying to ensure that the machines have high duty cycles. The ambulatory clinics are high traffic areas as well. There are workflows in all this motion. There's nominal flow, which is planned flow, and there's anomalous flow or unplanned flow. There's also an incredible amount of waste in all this motion. The current systems do their best to address the waste, and the processes are in place to try and make it flow well, but those systems can only do so much, and in a way, they're flying blind. That's where providing the real-time information can open up that situational awareness. Even better, we can add automation to recognize the elements in the quote-unquote situation and trigger things automatically. So picture our air traffic control world, where everything is highly scheduled and orchestrated. With all that structure, you might ask, why do you need the immense amount of monitoring in situational awareness? All this monitoring and control is because there's no room for error, and you need the monitoring to detect anomalies. Air traffic controllers do as much monitoring as they do controlling. There are rules of the road for separation, both horizontally and vertically, and that's their focus. The handoffs between controllers is a critical component of what they do. Then there's weather and the comfort of the passengers that's considered as well. I would say in air traffic control, there's even more opportunity for controlling than there is monitoring. Quick note about automation. Workflow automation doesn't mean that somehow we're going to automatically move a patient to the MRI. It means we're going to remove some of the human effort from a workflow. And this is what they call the human-in-the-loop automation. It's exactly what you see in air traffic control and aviation in general. So now that we've talked a lot about these mobile workflows, how does it get done? A quick recap of where we're at. We have mobiles and an indoor GPS or IPS and GIS that gives us these beautiful indoor maps. That gives us our radar for monitoring the mobile workflows. Some of these workflows already have dispatchers that are using whatever tools they have, and mostly communication tools, to control the flow. If we can tie the real-time location information to the orders and the jobs, we have dispatching to view the information. We have the situational awareness, but we want more. We want to get into the workflow to monitor the details. And let's continue to use our air traffic lingo. So we want to monitor arrivals, departures, and dwell. Let's call those events, and we'll come back to what events are. If you think this is too futuristic, think about what you see when we have what we call the Amazon effect. There, the driver uses a GPS to monitor the workflow and a mobile to scan the package on your front porch, and that shows us the chain of custody of the package. They call this track and trace. This is being done now, and the only difference is that air traffic control can do this indoors. With the routes and the events, we can trigger things to happen. We can trigger notifications just like with the Amazon workflow. We can trigger other workflows to happen. A patient leaving a room to be transferred can trigger the room to be cleaned. The arrival of a stat lab sample to the lab can trigger the testing to start. In our definition of enterprise traffic control, we said that it was using situational awareness and automation to optimize mobile workflows across the enterprise. We described the situational awareness and automation, and we talked about the mobile workflows. But the last part is very important. That clause, across the enterprise, means that we don't just focus on individual workflows. We need to ensure that the handoffs are being done. Like we said, for our air traffic controllers, those handoffs are critical. This gets into something we talk about in improvement called theory of constraints. You have to find and optimize a constraint to get flow. So this is all high level, but you can see how doable this is. There's no new groundbreaking technology that's missing. We haven't even talked about what we can do if we can track property. There's more systems work to be done. That's obvious, but what's most important about this stage is the framework. The air traffic control framework sets this vision into motion. When I worked at Henry Ford Health System, I used to spend all my time at the hospital. I was managing location services. I did that for 4 years and started to see what this next evolution of location services should look like. I knew that being in the hospital was where I would learn. I had my laptop and I had places where I would find a setup for the day. I would do ride-alongs where I would shadow people who were doing these mobile workflows in the building. Many days I would stop by the small auditorium and attend the morning safety huddle. I was proud of my health system for doing these. This is where you get a real appreciation for what's going on. There's total transparency for things that are going on, good or bad. The hope is that all the critical departments are represented, clinical and support services. They talk about hospital-acquired infections, delays in services, staffing issues, safety incidents, capacity issues, and many other things. I was sitting there in that room with about 50 people in it thinking, why is this once a day? Some of this is happening in real time, and it would be amazing to see this kind of dynamic in a command center. I still see the need for the safety huddle, but it would take the information from the command center. It would be able to refine the operations in the command center and affect the operations outside the command center. I couldn't get that image out of my head, and it set into motion much of what we're talking about today. I've been trying to structure these for as many audiences as I can, so I went with this dip your toe, shallow wade, and deep dive versions of these so that it can cover as many as possible. I'm calling this one the dip your toe in version of the enterprise traffic control. There's much more in the shallow wade version that gets into more of the architecture, and there will be a deep dive. So thanks for joining me today. I hope this provided a bit of a visual for what enterprise traffic control might look like, and I'll see you next time.